So we are recording today, and we will be keeping the recording going even in the breakout rooms, but we won't be sharing the breakout rooms more widely after the event. So just to reassure you about that. So just to think about a little bit of housekeeping, because we're a large group, as with all these online events, please keep your microphones muted when you aren't talking. Cameras can, of course, be turned off during presentations, especially if you're having difficulty with your Wi-Fi, which I know many of us have when there's all these cameras on. But please, if you possibly can, turn them back on for the breakout sessions, because this can really help in terms of people getting to know each other and being able to interact. But we totally understand that sometimes that's not possible. If you've got any questions or comments throughout the day, we do have the chat function open. I can see some of you are already using it. It's being monitored throughout the session, including in the breakout rooms, so feel free to use that. Now, some people have already contacted us in advance to let us know how we can best support their communication needs. So just to flag to everyone to be sensitive to the fact that some people need to use the chat function to help them participate, and that we have got that in hand. We will be monitoring that and trying to stay on top of that throughout the day. Because it is a large group, if we don't manage to cover everything during the session, we will of course respond to you individually afterwards. Now, as with our previous events, we will be doing breakout rooms. The first breakout room you will be randomly allocated to, and the second breakout room you will have the opportunity to choose. That will become clear as the day goes on. I'm just going to mention something now. Usually you will know if you've attended our previous sessions that we have quite a strong social media presence. So we usually do a lot of tweeting about the presentations. We make comments on social media throughout the session. But today we will not be engaging outside of this event. I'm just going to cough. Excuse me for a second. The reason for this is that many of our colleagues around the country and within Kent, our own institution, are on strike this week. You've probably seen it on the news. This is in response to national disputes over pension cuts, falling pay rates, poor working conditions such as high workloads, and also equality pay gaps, which are obviously really important. We decided that we did not want to cancel today's meeting, even though there are strikes on. But what we did want to do was let you know that in solidarity with our colleagues, and because we don't wish to cross that virtual picket line, we will not be engaging on social media or more widely today. And I hope you can all understand where we're coming from with that one. But the strikes are this week only. So from next week, we will be posting about the event. We will share the presentations on social media and our project webpage, just as we would normally. So I just ask you to be aware of that really today. Okay, so could you go back a slide for me, Wenjing? Just before I give the schedule of events, I just need to flag that we are funded by the National Institute for Health Research, and that the views expressed today, including those about the strikes, are those of the team and not necessarily those of the NIHR or the Department of Health and Social Care. It's really important that we say that because we are funded with public money. So let's go back to that slide and have a look at our schedule for today. So we're going to begin with a presentation of the work so far from Georgina Walton, my co-lead at KCC, and John Potts, who leads our lived experience working group. Then I'm going to hand over to Raza, who's one of our researchers in residence. I'm sure many of you have already had contact or communication with Raza through the email and so on. Raza's going to be talking about our communities of practice. Thereafter, there will be facilitated breakout groups, as I mentioned earlier, and an opportunity to start thinking about research topics and ideas for those communities of practice in quite what I hope is going to be quite a fun and interactive way. We're then going to be taking your feedback through a very short survey and have a little comfort break. Then in the second half of today's session, we've got Becky Sharp, who is the implementation manager for social care in the Applied Research Collaboration, or the ARC. Some of you may have heard of the ARC in Kent, Surrey and Sussex. Becky is basically coming along to talk to us about one of their communities of practice, which is around domiciliary care or home care. And that will help us hopefully get a better understanding of how they work in practice. Then our own community of practice lead, Farhana, will be sharing some top tips and resources with us before we divide into our final breakout sessions. And there will only be 2 of those, so you will have the opportunity to do a little trial run of a community of practice with either Farhana or I, so there'll be much bigger groups. And then if we have time at the end, there will be a little wrap up for me and thinking about next steps. Okay, so thank you everyone for listening so patiently. Without further ado, I'm going to hand over to Gina and John for our first presentation.
Thank you very much. So as Anne-Marie said, I'm Georgina Walton. I am a Senior Project Manager within Kent Adult Social Care, and I am co-applicant within this project. So I'm just going to recap on what the project is all about. As Anne-Marie mentioned, we are joined today by some people that haven't been part of previous meetings. So I'm just going to very quickly recap on the aims of the research partnerships. So for some time now, we have been within social care trying to build more of a focus and culture around research. We are at a very different stage in terms of research compared to healthcare, and we really have been trying to drive a culture around research activity and embed research within practice. And a couple of years ago, National Institute for Health Research gave us that opportunity to access funding to be able to work in collaboration with partners to co-produce an approach that will allow us to test some ways of building research capacity, which includes communities of practice, testing out researchers in practice being embedded within social care teams, and really trying to create a research culture, and then looking at how we sustain that activity once the funding ends after the 4 years. And this really provides the opportunity for us to do some cross-partnership working and learning across the country and sharing good practice. Next slide, please. So hopefully you're now becoming familiar with these faces, as we've shared these in the last events, the previous 2 events that we've had. This here is the core team, so these are all the people that make up the project, and as you can see, we're made up from the University of Kent, other universities within the region, Kent County Council, and very different roles as well that make up the team. And the next slide, and then the extended team are, we have care sector representation, the ARC, so that's the Applied Research Collaborative, and public involvement expert with Amanda Bates, who really helps us think about how we engage people with lived experience, which John will talk a little bit more about in a moment. So the next slide, please. So just to touch upon what we are focusing on during the 4 years, the research project started in June 21. We had an event back in July which launched the research partnership. There's 4 key areas that make up this research partnership project. The first one is around communities of practice, which we're focusing on today, and how we're going to evolve those communities of practice based on research priorities that we've been identifying with many of you over the last 2 events that we've held, and wider engagement with other people. Testing the researcher in residence, so we have researcher in residence based within the University of Kent, and that's made up of a job share with Raza and Wenjing, who will be talking later today. And we have a new researcher in residence, Lily, who's just joined the Kent Adult Social Care teams in the last 4 weeks, and we work very closely with our operational teams in the care sector to help embed research within practice and support practitioners to consider how they get engaged with research activities and help their professional development. The third element of this project is around funding that we've set aside to bring to life pilot projects that can become research projects and training fellowships. So that's a really good opportunity to for some of our practitioners in the care sector workforce to develop their research skills and experience research projects. And then the fourth work stream is around how we share the learning and impact from the work that we do, not only locally but nationally, and share the good practice and use the impact and the learning from this to inform how we sustain some of these activities in the future. Next slide, please. So today is the third networking event. We have already held 2 events. The first one was in July, which was our launch event, and then we had the second in November. And during those 2 events, we engaged, hopefully many of you that are with us today, to look at what the research priorities should be, which we can now start to take forward in the communities of practice, which we're focusing on today. But we've also then had wider conversations with people that are supported by adult social care and carers, staff both within internal to the local authority and staff working within the care sector, and groups which include voluntary sector, to understand what those research priorities should be and how we can develop this project further. We've held a couple of research workshops to engage people around how we undertake research and what opportunities research can present in terms of informing and improving practice. And we've recently launched a blog, and we will be doing these on a monthly basis, so you can keep in touch with all the work that we are doing. And the recent blog is about the why this research project matters so much to adult social care. So the link is there that you can go on and read after this. And as I say, we will be doing a blog a month that will focus on the project so that you can keep informed on how we're progressing. So I'm now going to hand over to John, who's going to talk about how we have been involving people with lived experience.
Thank you very much, Gina. I'm John Potts. I'm a lay member and co-applicant to the project, and as a result of that, I chair the working group. This working group is a small group of people, up to 10 is our target, and we meet every 6 to 8 weeks. But there's work going on in between that time on an individual basis. We're involving people with lived experience of social care or care for somebody who does. So it's important that we've got the message right from the root of this situation. Research experience isn't necessary for our members. Training and support will be provided as appropriate. We're working on some initial training right at this moment. Some examples of how working group members will be involved are listed here. Helping agree strategic research priorities for the partnership, priority setting in Kent adult social care, contributing to interest groups, coming together to share ideas and evidence of best practice, to contribute to all aspects of the partnership, including giving your views about research projects and ideas, and assisting with evaluation elements of the overall project and support wider communication and dissemination. And the members of this group will also be playing a very active and involved role within the communities of practice. So thank you very much for your time. I'll now pass on.
So Rasa will talk with us about how we come up with the current communities of practice themes in adult social care research in Kent.
Thank you for the introduction, Wenjing. So hi, everyone. I'm Raza. I'm one of the researchers in residence, or half of one, on a job share with Wenjing. And I'd just like to talk through kind of how we got where we got today, and kind of how we developed what we'll be looking at. Now, I have to apologize first and foremost. I've got a spot of COVID. It's not affecting me a lot, but if it starts doing so, Wenjing will jump in and take over from me, and I hope you will excuse an occasional cough or need to blow my nose. Right, Wenjing, please may I have the next slide? So just as Gina has already mentioned, you know, this is the 3rd networking event, and it may feel like overkill, like a lot of networking events, but we really wanted to make sure that what we work on, what communities of practice we set up, are truly based on the priorities for people living in Kent, whether they're people with lived experience of receiving support, whether they're informal carers, practitioners, researchers, commissioners, etc. So what we've done between the first event, and I'm noticing from your names that some of you have been to either both of one of the previous events. What we've done, as some of you will know, next slide please, Wenjing. What we've done is we went away and we looked at the recordings of all the breakout rooms. I think we had 10 breakout rooms with 20 minutes worth of discussion in each, so hours of information. And we started grouping those priorities. Next slide, please, Wenjing. And from that grouping, we came up with priority areas that we then brought to the second networking event and asked you to rank, almost like prioritize the priorities themselves. And, you know, got some indication from there. Next slide, please, Wenjing. However, what we also did at the second event, which some of you will remember, is we acknowledged that a priority area and community of practice is not the same thing. It's not tangible enough. And then we asked you in the second round of breakout rooms, well, how would you translate these priority areas that we have now voted on with really good representation, again, from people with lived experience, you know, supported by services, informal carers, service providers, even an occasional commissioner. You know, how do we transfer them into something that looks like a community of practice? And again, we had lots of information to go away and look at, lots of recorded material to go through. And again, that's why we're recording today too, even though we won't share breakout room discussions. Next slide, please, Wenjing. So what we came up with, or what became quickly apparent to us in this, a priority area is not the same as a community of practice, that people who spoke at the second breakout room in the last event acknowledged the tension between having something broad enough that it captures enough interest, that enough people want to join it, and simultaneously something specific enough that it's not kind of opaque, but something you can operationalize, something you can get your teeth into. And this is where, looking at the themes that kept coming up in those breakout rooms from the second networking event, we started building this house. So the roof of the house is that broad theme, is that something that keeps it all together. Another thing we noticed is, or in fact, at first we thought that these three things, these foundation stones that you're seeing at the bottom of the house now, at first we thought maybe they're a community of practice in and of itself. But the more we looked at what you told us last time, the more we realized that actually it always came in tandem. So people spoke about self-neglect or autism and sort of stressed in the same breath how important co-production would be for any work on autism, for example. So, you know, involving people living with autism in anything that a community of practice around autism would do. Equally, equality, diversity, and inclusion, so that we don't just ask people living with autism who are the easiest to ask, perhaps, to, you know, to take part in research, that the set of people involved is truly diverse in terms of gender, in terms of age, and plenty of other characteristics too. And what also kept coming up kind of in tandem when we heard different themes is this need to be practice-oriented. So although these communities of practice are around research in adult social care, whatever they do has to apply to frontline practice. It can't just be the knowledge for the sake of knowledge. So we built the roof and we built those foundation stones. And then we started building the walls and the floor. So we acknowledged that there were many different topics that kept coming up in those discussion rooms under the broader roof. And that some of them were quite specific, while others were much more generic. So to give you an example that I made up on the spot, a very narrow focus would be if someone wants to work on, let's say, women over the age of 50 who are living with newly diagnosed autism and ADHD, right? So it's quite a specific group of people, quite a specific area of interest. Something much more broader that would be closer to the ceiling, as these orange bubbles are located, would be something like insector retention that you will see came up for the second community of practice. So a much broader focus. Next slide, Wenjing. And then, as well as balancing out this broad and narrow, there's also the floor, the time element, acknowledging that whatever has come up in that, second networking event is just the start, and focus may change over time, and so it should. We want ideas or interest areas under these community of practice roofs, in the house, to come up organically, to develop over time. And we also acknowledge that even though there might be a group working on one idea, a group working on another, that so long as they sit under the same roof, they are connected. There will be links in terms of topics, but there will also be links in terms of members or who's working on what. So that's kind of the general structure, and I hope I didn't waste too much of your time explaining what it looks like. Now to the meat of it. So when we went away and looked at the themes that are emerging or what might form a community of practice, the first thing that came through really strongly and that bound quite a few ideas together is supporting people with complex conditions throughout the lifespan. So you will see from those smaller orange bubbles that there were specific topics within it. Adults living with autism was one of them. Self-neglect came up quite frequently in different rooms, so completely different groups of people brought it up independently. We know that these are areas of interest where there's enough of you out there to band together, in terms of strength and numbers, and work on it. Transitions between services came up. That perhaps is a bit broader than self-neglect, but was another aspect. However, where these orange bubbles come, they are a wish list, something to start with. When we go into the first breakout room today, you'll have a chance to kind of change those orange bubbles, change the specific ideas. So they're not entirely prescriptive, but they're giving you an illustration of what we found so far. Next slide, please, Wenjing. And the second community of practice that came up was, perhaps unsurprisingly, one about enhancing, diversifying, and sustaining social care workforce. And again, we found quite a few different topics within that came up and repeated in different rooms, with people independently expressing an interest in working on them. So in-sector retention was one of them, and reconsidering what in-sector retention means, that it's not necessarily retention within a single organization like a single care home, but how do we make sure that even when people progress, that they stay in the wider sector, and what opportunities are there to retain the skill and to retain the enthusiasm and capacity of the adult social care workforce. And training came up too. So I hope this gives you an illustration for something we can focus on in the breakout room next. And I'd just like to stress that there might still be an opportunity to consider a third community of practice. So if you feel from listening to me talk for a while just now, if you feel, oh, that completely missed what I'm interested in, or maybe I came to the last event, but it's what I'm interested in is not reflected. It is a matter of getting enough people interested in the topic to be able to take communities of practice forward. But we still have flexibility to consider another one. So perhaps this is another something we can focus on in the breakout rooms. Thank you so much for listening to me talk about how we sort of started with priorities and your interest in the first event and arrived at these house models to communities of practice. And I'll hand over back to Anne-Marie and Wenjing to introduce the breakout rooms.
Welcome back to the main session, everybody. Hope you enjoyed your breakout rooms. Ours was brilliant. We had so many excellent debates and conversations and lots to add to those houses. Always feel like there's never enough time. But great that there's so many really good ideas coming out. So I'm going to hand you over now to Wenjing, I think, who's going to talk to you a little bit about completing a very short survey for us before we have our comfort break.
Thank you, Anne-Marie. I'll shortly share a link in the chat box, which will, I'll share it on my screen as well, which will ask you some very brief questions about which community of practice you'd like to join, and it's here, and what is your role? So it can be the one or both of them, which you discussed with your team members earlier, or if you'd like to suggest any other community of practice, please write it there and we will check back all your responses. We would also like to know what your role is, as well as your contact information if you'd like to join those community of practice. We will follow up with individual via emails and telling you what will happen next in the coming weeks. Also, if you have any suggestions on who else we should invite to the communities of practice, either for both of them or a specific community of practice, please leave your suggestions there. Also, I know the breakout room session is always too short for you to express full. So if you have any other comments, please write it there and share it with us. So here is, I'll put the link in the chat now.
Great. So Wenjing's popping the link into the chat. If you click on the chat box, you should be able to see that link. And then if you just click on it, it will take you to that form. And really, really valuable for us to get some indication of which community of practice you would like, or both, or neither, that you would like to be involved in. And as Wenjing said, just to give us a little bit more information so we can make sure that we stay in touch with you properly about these communities of practice afterwards. I'm going to introduce our next speaker. So it's my pleasure to introduce Becky Sharp, who is the Implementation Manager for the Applied Research Collaboration in Kent, Surrey and Sussex. And Becky is here to talk to us a little bit about an ARC community of practice, although I don't think that's quite the same terminology that they use, but it's the same idea. So I'm going to hand over to Becky. Thanks, Becky. You're on mute, Becky.
You'd think after 2 years I'd be used to that by now, wouldn't you? Sorry about that. So, is that better?
Yep, you're good.
Yeah, I'm good. That's good. You'd think after 2 years I would have got used to the unmute button by now. So just, hi everybody, I'm Becky Sharp, as Anne-Marie just introduced. I'm the Senior Programme Manager at Kent, Surrey, Sussex Academic Health Science Network, and the implementation lead for the Applied Research Collaboration Kent, Surrey and Sussex for their social care theme. And just very quickly, for those of you who are not familiar with the ARC, or the Applied Research Collaboration, so I'll use the term ARC, but that's what it stands for. It's a research infrastructure that's funded similarly to other organisations like the Research Design Service and the Clinical Research Network. It's funded by the National Institute of Health Research. And its focus is to support applied health and care research. And we're built up of a network of 15 regional ARCs covering the whole of England. And as the name suggests, each ARC is a collaboration of member organisations, which includes local NHS providers, local care services, commissioners, local authorities, universities, and also voluntary sector as well. And Kent County Council is one of them. And I should also say that each ARC, including KSS, has a number of themes that reflect priority areas for their local population. And in Kent, Surrey and Sussex, this includes social care, but also children, young people's mental health, primary care, and also supporting people living with dementia. And for those who are not familiar with the AHSN, we're primarily funded by the NHS England and support transformation in healthcare, including spread and adoption of new innovation and innovative practice. And as this slide that Wenjing's sharing for me sort of shows, The HSN role as a member organisation of the ARC is essentially the implementation arm of the ARC, and our focus is to bridge the gap between practice, so that includes the public, users of services, service providers, commissioners, and of course academia. And it's to support our academic colleagues to develop research questions and projects that are informed by the needs and challenges of our local care systems and local populations, and also support the system leads and our colleagues in practice to implement that research into practice and support evidence-based service provision. And in order to achieve these aims and ambitions, we need to increase awareness about the value and benefits of research and build research capacity and stimulate interest in research and help the social care sector to be research ready. So you can see that some of the ambitions of the ARC match and complement the Kent Social Care Partnership. So we work really closely together. And today, I think we've already said today, sorry, Wenjing, just before we move on. So today, I think most areas of social care have been really underserved areas in terms of research, which I think we've alluded to already, compared to health. But I'm sort of pleased to say that this is definitely changing. There's new funding opportunities, new infrastructures aimed specifically at research and implementation in social care. So next slide, please, Wenjing. Thank you. So how are we achieving these aims in the ARC? Well, many of you will be familiar, we've spoken about them today, the term communities of practice, but we're starting to refer to ours as communities of experience. Same principles, it's about bringing together a group of people, so a community with a shared area of interest, the domain, but importantly as equals to learn from each other's experience, to learn from each other's stories and the challenges. And for the ARC, the purpose of our communities of practice is about our researchers and academics hearing people's stories and challenges to develop relevant research questions and consider the outcomes and outputs of their research and the potential impact that research might have. So those stories of experience need to be from those with lived experience and those who support and care for them, so provider organisations, as well as commissioners and policymakers too. And what we hope is that this hopefully sort of creates pull from the system for the evidence and then supports implementation into practice as the answers hopefully are anticipated and of interest. So these communities of practice or these communities of experience is the platform that brings all of these people together. So on to slide 4, please, Wenjing. So, sorry, there's a lot of words on this slide, but it's taken from the terms of reference from these communities that we run and outlines what our aims are within these communities of experience or practice and what we hope to achieve. And I just want to draw out a couple of points that I haven't already mentioned. So through these communities, we want to identify gaps in research and research opportunities, but also hear about the great work that is already going on regionally from practice. And we know that there is lots of innovation and we want to help evaluate, spread and share good practice. And I think the Kent Adult Social Care Partnership is one example where we are watching and supporting and looking forward to sharing its successes to other local authorities in our region. But it may be a more specific topic or area of focus, such as digital innovation, new pathways, or support to ensure more inclusive practice. But ultimately, these communities provide a platform for dissemination and the implementation of these research findings into practice. So next slide, please, Wenxing. So last year, we carried out a series of focus groups in order to determine the regional priorities for research and implementation in social care. And this lovely illustration captures those results. So very happy to share a link with you to this illustration. But if we can just focus on the star in the middle and the communities of experience section in the bottom left. So these are the priority themes that came out. And from these, we've developed or developing a number of communities of experience. So if you look in the middle, there's home care, inclusive practice, another one on carers developing, voluntary sector, and also digital innovation. And in the bottom left, through the communities of experience, the reflection from those we spoke with during the focus groups or when we presented the findings, it was important that these communities connected people, that it involved seldom heard groups, and I don't think we've cracked this yet, if I'm honest, that we evaluate, implement and spread innovative practice and work with industry on new innovations. And we want the community to not only inform the research, but also the implementation. You know, what are the barriers and enablers for this research to be implemented? And finally, it's important that we create and measure impact, because at the end of the day, it's about improving outcomes for all, and those receiving care and those providing care. So if you could just move on to the next slide, please. I can just talk a little bit about our home care community experience that's grown very quickly and developed in a short space of time. So from an original meeting floating the idea with around 12 stakeholders, to a second meeting of over 40, and a third meeting we held recently that had over 80 sort of people interested in this space, so the domain, the shared area of interest. We now have 130 plus colleagues signed up to this community, all with an interest in home care. It's a really vibrant community, and membership, and in some ways COVID actually has helped us, because by running them virtually, I think we do get more people attending. And membership includes members of the public, it includes providers, commissioners, support organisations such as Skills for Care, representative bodies like care associations, and also policymakers. So we have representation there from the Department of Health and Social Care, and also what was Public Health, now UK HSA, or UK Health Security Agency. So you can sort of start to see the sphere of influence that these communities can have. And we heard from Gina and John earlier about the importance of public involvement, and I have to hold my hand up here really and say that we do need to include more voices from the most important people, so those actually receiving care at home and those directly providing that care. And I just want to take a minute to acknowledge the great work that they do. And it won't have gone unnoticed by any of you that the home care sector has experienced its most challenging time, significant ongoing recruitment and retention challenges, large job vacancies, and thousands of hours of unplaced care each week within our local authorities, and I think probably ever increasing demand. And the impact of this is felt through the whole chain. We talked in our breakout group about integration, and that's really important, because the impact for home care, and the struggles that they have at the moment is felt by service users, it's felt by their families, providers, social workers, community teams, and also obviously our health system, with people being stuck in hospital and unable to be discharged home. So how has the community experience sort of helped with those challenges? And I think we have done in terms of using that community as a platform to share research and evidence. So we've done so around work done at the University of Kent, looking at the retention and sustainability of the home care workforce through the Rescue project. And also research carried out by a team including Anne-Marie on quality of life at work from the adult social care workforce. And in Sussex, for instance, this work is being directly fed into the ICS strategic plans to deliver a more sustainable home care workforce. So it's a great example of how that community has supported dissemination and implementation of its existing research that is already out there. And it's great, because there is so much great research out there that perhaps currently doesn't get to be applied in practice. Of course, we also need to measure the impact of that as well. So our job's not done there either. And with regards to existing research projects, we have used the community to share the aims of projects, seek input on questions from the researchers, testing emerging findings to hear if they resonate. And an example of this would be a project we have underway looking at the discharge to assess pathway, specifically looking at the community side. And the community experience has helped socialise this project. The system anticipates the results, and we've also had expressions of interest from people wanting to be involved. So as the project develops, we plan to share the emerging findings and understand how we might support that implementation into practice. So it might be a new pathway, for example. Undoubtedly more research will be needed. However, I think it shows the value of these communities coming together to sort of share experience and share knowledge around all of these aspects. So the next meeting at the end of May has a focus on inclusive practice, supporting end-of-life care, or how home care is a key partner within end-of-life care. And as an ARC, we're keen to develop new projects. So working closely with one of our other themes, the public health theme, we're developing new projects looking at sort of like the interface between health and care, and how we can support the home care sector with prevention, whether that's falls, whether it's infection control. So it's really good to be able to talk about these ideas with people actually, in practice and on the front line. So all of these sort of projects are at differing stages of development, and some may be time limited to support specific projects. So some of these communities of experience, I should say, might be time limited, but they're a great space to come together and hear different perspectives and views. And I think the takeaway from me as the Kent Adult Social Care Partnership is developing their community practice is that they do take a lot of planning in order to get people in the room, virtual or otherwise, and it needs to be useful and relevant to the audience. And I think they benefit from being sort of formally informed, if you like, so they do need structure and agendas and everything else as well. And it's getting the right balance between presentation and speakers, and then sort of time for discussion. I think it's also safe to say that the more actively you participate, are curious, the more participants also get out of it. So it needs to feel a safe space to share thoughts and experiences, no judgments. And I can almost guarantee that when someone is brave enough to ask a question or share a story, it often uncovers shared experiences and also different perspectives or solutions that other people have found. So that's just a short run through of the work we're doing on communities of practice within the ARC. So just moving on to the final slide, please, Wenjing. Just to say thanks for listening. I just wanted to acknowledge my colleague from the ARC, Dr. Jolie Kamink. She's a research fellow at the University of Kent, who I work very closely with and led the research project to identify our regional ARC priorities for social care research that has led to the development of these communities of experience that we have developed in the ARC. And please do get in touch with either of us if you'd like to hear more. And finally, to the Kent Adult Social Care Partnership team who asked us to come along and talk, and who are also coming to talk at one of our ARC events around capacity building in social care in May. And hopefully we can sort of share the details of that event. So you're all welcome to come along to that too. So thanks very much. And yeah.
Thank you so much, Becky. It's so interesting for us to be able to learn from your experience, and I'm sure everybody found that really useful, because otherwise it sounds like such an abstract thing, doesn't it, when you're talking about these communities of practice. So really useful to see how it's emerging and how it's developed, and such amazing engagement. So hopefully we will have some people from today who might decide they want to join your home care community of practice, and likewise hopefully some members of your home care community of practice might decide they also want to sign up to some of our communities of practice that we're launching today. I'm just going to say, Lily, ARC stands for Applied Research Collaboration. Okay, thanks, Becky. So our next speaker is Farhana, and she is a person in the Kent Research Partnership who is leading on Work Package 1, which is all about communities of practice. So over to you, Farhana.
Good afternoon, everyone. Well done for keeping with it. And I want to give you some top tips around what's involved to become a member of a community of practice and what's available. Next slide, could we have that, please? So why get involved? You're thinking, we've spoken to you about these various different themes, what are you going to get out of it? And it's basically a space for you to learn, and it's a social form of learning, getting people together on a fairly sort of regular basis with a common sort of passion for learning, and this picture gives you a sense of building trust with each other in your community of practice, having some shared intelligence around a particular issue that you're encountering, having a common theme or purpose that you might want to address. So it's really creating a learning loop as individuals or members of the community of practice are responsible and for each other's learning and bouncing ideas off each other. And you might find somebody has a solution for a problem. It might help to refine your skills with dealing with a particular issue. Can we go to the next slide, please? So you've seen this diagram from Becky before, but I wanted to sort of have a bit of a stronger focus on it. So with your topic in mind, so that might be the ones that we've presented to you today, which is sort of called the domain. You might want to start thinking about and preparing some thoughts and ideas about that particular issue or a theme within that particular community of practice to discuss in your group or your community. And then you might want to reflect upon what you'd like to get out of the community of practice to build research in your own work. But we won't sort of just throw you in at it. You'll have a facilitator who will have prepared some discussion points ahead of the conversation to really help stimulate that conversation for you to start bouncing those ideas off each other. So it's a space where you can bounce ideas drawing from practice, you know, really sharing from some of the stories and whether you've identified some tools that might help with a particular problem that you're encountering. So next slide, please. So so in terms of sort of how a community of practice might run, you know, each session does need planning. They don't really work spontaneously without having somebody at least taking charge of it and being a facilitator. That's quite critical. So members you might actually start sharing some experiences, update on some successes, some challenges. But some of you might already have some preset ideas that you might want to raise and discuss within your community of practice. It might be actually that a member of the community of practice itself wants to do a presentation or talk about a particular case, a particular situation that they've found themselves in. Or it might be that we could, the facilitator, or with agreement with everybody else, we could identify some people who could do a talk at the community of practice to stimulate conversation, stimulate learning. You might want to consider a particular framework, approach, or a tool. Can we go back to the previous slide, please? A framework or tool that you want to bring to the discussion, and then there should be a sort of a summary at the end with points to carry forward. And then what's really important is to decide on the next talk or topic for the next community of practice session. Next slide, please. Right, so what's really critical is that facilitator. So it takes the onus off you to sort of put things together and to organise when the next date is. So the facilitator will be responsible for organising that for you, and the facilitator will also be responsible for guiding the conversation, but also allowing others to have the chance to speak. It would be good if the group, you know, at your community of practice at the beginning, you could agree at the start how members might want to indicate their desire to speak. So you might want to use the chat function, raise hand function. And I've got to say, you know, sometimes silence is okay. I always say that. It gives you breathing space and it gives you time to think. Can we have the next slide, please? Right, so because the community of practice will be run virtually, very similar to the one that you've heard about previously, if possible, for the community of practice session that, you know, for the afternoon's trial and future, to have your cameras on. And it's really helpful, as I've seen this more in the earlier session, to have your camera on, because then we can see if you're trying to speak. You know, obviously use the raise hand function if you want to demonstrate your next turn to speak. It really helps to sort of link and bond with other people if you can sort of establish that facial contact and see what people's body language is like. And what we find sometimes, people who join on audio, and there might be good reasons why people can only join on audio because somebody's internet is dropping out, but sometimes people who do join on audio tend to not be completely involved. Can you have the next slide, please? So I think you might want to decide in the group itself, perhaps not for today's session because we're short of time, but in the future, how you might want to use that chat function. Obviously, you're at liberty to use that as you wish, and the chat box is useful if you want to share resources. Members of the group, you know, need to decide how that chat function could be used, because sometimes it can be a little bit distracting. But I also appreciate that chat function is quite useful for people who need to indicate, you know, their key messages. Can we go to the next slide, please? So we have got some we've set up a sort of some resources for you. Well, at the moment, it's an online web space called Glass Cube, which provides a virtual space to support the communities of practice. So it's really there for you to post your ideas, share thoughts, any interesting information you might want to announce, relevant opportunities around research. And also you could find some useful information there if somebody else has posted it on there. And the idea is that we'll also provide additional training sessions around the needs of the community of practice, but it's for the community of practice to decide itself what those topics might be. And then we might also organise some smaller talks for each session, which the facilitator might become involved in organising. Right, can you have the next slide, please? So this is just a screenshot. I apologise, the writing is incredibly small, but that's a screenshot of the glass cube web space that we've set up. And, you know, when the time comes, we'll obviously give you a link to that web space for you to start utilising, but that's just a signpost it for today. Next slide, please. Right, and so what we'd like to do is to give you a trial of a community of practice in the next, in the time that's left. So can we go to the next slide, please? So some discussion points. I'm conscious that we're running out of time. So these are the sorts of things to discuss in this afternoon's session. So are there any ideas for topics and research priorities that the community of practice has identified? Would you like to identify some speakers about those particular topics? How often would you like to meet? How often would you like to have speakers? Can members invite new members to the community of practice? And then there'll be a sort of a summary of discussion points to carry forward. Right, and the last slide, please. Right, so, you know, as is the case, there are some sort of ground rules for this afternoon's breakout session. So everyone, you know, has the right to be heard, has the right to their airtime, and participation is voluntary. And I appreciate people will engage in different ways. Just because you're silent doesn't mean that you're not engaging. Please do assume confidentiality in the community of practice, unless otherwise agreed. Please do listen actively and respectfully and ask for clarification if you're not certain about what somebody is talking about. You know, be honest to yourselves and with others. Speak for yourself and avoid generalizing. And the facilitator is, of course, part of that group and will abide by the ground rules as well. Okay, so the next step is that you should have, I think Anne-Marie will introduce it, there'll be an opportunity to join one of the communities of practice shortly. And I hope that that makes sense to everyone. And please do talk to your facilitator in that session if anything is unclear.
Thanks, Farhana, just unmuting there. So yeah, so what we're going to do now is I'm going to hand over to Alan, and he's going to give us a choice, and you'll be able to make a selection about whether you want to go into the complex conditions community of practice that we talked about this morning, or whether you want to go into the workforce community of practice. And then once you're in your rooms, Farhana and I will facilitate some discussion, really, just as Farhana introduced, and just to try and give you a taster so that you don't come away from today thinking what's next. You'll get a better idea of how it might work going forwards. Welcome back, everyone. Hopefully everybody's starting to rejoin the main room. Just having a little scan through, check that people are coming back. Looks like it. Okay, we've only got a few minutes left. I hope that you found those little breakout sessions. I know they're very brief, and I know there was a bit of trouble for everyone to get into the right room, but once everybody was in the right room, I hope you found those conversations interesting and useful, and have started to think about some of the more concrete things moving forwards, like how often you might want to meet and how you might want to involve people in your group and things like that. So our group was really interesting. I think one of the points that I'd like to make from coming out of our group is just how important that we've said it would be for that co-production part of the house. So if you remember when Raza presented the houses, we talked about the bottom around co-production being part of the foundations of our communities of practice. And the complex conditions one, this came across really strongly, you know, that it's going to be really important to have people with lived experience involved in those. So I think I would just encourage the people that have chosen those particular groups to also consider trying out the other community of practice as well in these early days, so that you get to have a feel about which one best suits you. This was a bit of a taster today, but you may find that you fit in both camps. Farhana, I don't know if you have any comments that you'd like to add to that.
I think it was Liz who talked about, you know, we really need to think about some creative thinking to think around the challenges around pay and conditions. And there was also conversations around needing the professionalisation of the workforce. I think that was Annabelle who said some really valued points around that, as well as Lawrence. And Marion had some fantastic points around that professionalisation of the workforce.
Brilliant. So lots of really good things coming out already, and we've already, I think, identified that we might want a speaker at our next community of practice. Or so yeah, I think some really good work going on. So in terms of next steps, what will happen now is, for those of you who haven't already managed to complete the survey, we will share the link again. I think that's going to pop up in the chat shortly. And you may feel now, having participated in a couple of breakouts and heard a couple more presentations, that you want to add something more to your comments. So feel free to follow that link again and just update it. That's not a problem at all. If you now feel that you've had some more ideas, or you want to express an interest in the other community of practice than you did earlier, not a problem. What we will do is we will use your emails that you've provided when you registered, and the survey information that you provide to us, to contact you in the next couple of weeks. And we will just remind you of which ones you've expressed an interest in, check that that's still what you want to do. And if you've changed your mind, that's perfectly okay. And then we will invite you to join that community of practice. Now, one thing that we haven't had time to do today, but I think we will need to run a session on, is the platform that we're going to use to support the communities of practice. So you remember that Farhana popped up a screenshot of something called glass cubes and said, this is what we're going to use. I'm very aware that we've not given you any information on that whatsoever. So I guess that will be a very early thing for us to arrange, just to give everyone a really good presentation on glass cubes, and really support people to have a go at using it and check it out. So we'll get into the detail about that after the event. So I'm going to be quiet now and just open the room up to all of you, and just ask you if in these last few minutes there's anything, any comments, any questions, any observations that you'd like to make before we close today. Please feel free to just raise your hand or type a question in the chat if you prefer. Stunned silence, I think. Okay, I'm going to take that as that people are basically happy with the next steps, and that we will be in touch about glass cubes, about the communities practice that you've signed up for, and to really get this going now so that we can move from all this talk to actual action. We will send you all the links so that you can watch these back, including all the presentations from earlier. The only thing that we won't share is those breakout conversations, because they're just for us. Right, thank you everybody, and thank you so much to all our wonderful speakers today. I hope you enjoyed today's event. All right, thanks everyone.